I'm Laura Gilhousen, a registered nurse, certified diabetes care and education specialist at Ashtabula County Medical Center. Yesterday was Diabetes Alert Day, and so I'm privileged to be able to talk with you today a little bit about diabetes prevention. What are some of the things that you're going to look for when diabetes is knocking on your door, but it didn't come through the door yet? I've been a diabetes educator for a little over 10 years now, more like 15. And what we do is help people, first off, learn about this very interesting disease process, but also it's a lifelong learning because it's a lifelong disease. And as you live with it, we learn more things about how to use it, how things work, what doesn't work. So the biggest piece of what we do is care. A lot of times people have had diabetes for a long time, or they're in that pre-diabetes where its numbers aren't quite where we call it diabetes, but there's still lots that can be done to keep you safe. And the whole point is being safe for as long as possible and avoiding complications for as long as possible. But more importantly, it's living life the best way, as on your terms, as long as possible, with as few complications as possible. So some things that put you at more risk. There are lots of risk assessments out there online that you can find by doing diabetes, pre-diabetes risk. Some of those key things are any family history. So doesn't mean it's a guarantee you end up with diabetes or pre-diabetes, but it is a risk factor. Activity level is a big risk factor as we slow down. That makes more insulin resistance, and then of course it leads to more challenges with managing blood sugars. Of course, over time the body doesn't work as good as it could, and you can turn into having diabetes. Some other things on the assessment question are, like, if you have high blood pressure, if you're a woman and had a baby that was 9 pounds, or you were told gestational diabetes, that increases your risk for developing pre-diabetes and type 2 diabetes. Let's see, so we've got weight, the blood pressure, if you're a man or a woman. There's 3 categories for points by weight, and then if you score 5 or more, it's time to talk to the doc and see what we can do for your risk factors. One piece of it, whether it's diabetes or pre-diabetes, is making the best food choices you can and moving more, which, now that it's spring, this is the best time to go, hey, let's move more. We keep talking about 3 or 4 different kinds of diabetes here. Let me just run through what those are. Type 1 diabetes is your immune system wiped out your cells that make insulin, so you have to have insulin to live. It's also finding what mix. It's not a one-dose-fits-all thing. Everybody's doses and needs are different. In type 2 diabetes, it's a slow progression over time, usually, where your body just slowly starts not making enough insulin to take care of business. Gestational diabetes is when you have that stress of pregnancy. Your numbers start to get a little too high than what's safe, and then we need to take care of that. And then type 2 diabetes, gestational, and then pre-diabetes. It's when your numbers are a little bit higher than what normal is, but they're not so high that we call it diabetes. Does that kind of make sense to everybody? Another kind of way to think about this is, excuse me while I reach, we kind of say, think about it, there's special cells in your body, in your pancreas, that make insulin. So when we're young, everything in your body works right. Kind of think about the last time you washed dishes. It was in the water. You pulled it out of the water. It's all dripping down. Of course, I'm in front of a computer, so I didn't choose to bring a bucket of water. So at the very beginning, when all that water's flowing off, no matter what you do, the body can handle it. It fixes it. It stays on top of it. Of course, life starts wringing it out. So, at the first beginning, when you're wringing it, lots of insulin, lots of water is still coming out. Later on, it's still wet, and you wring it, and you're getting a few less drops, and then eventually it's still wet, and you're running out of drops. And that's how you kind of can think of the progression of diabetes. At the beginning, we want to do everything we can to make the load as safe as possible so that we don't wear out our resources. So food choices is always a big piece, which March is also Nutrition Month. And you can't really talk about blood sugar without considering the effect our food and meals have on it. I'm not saying it has to be perfect, because we're finding a lot of things that you have to eat what you got, but let's find out what works for you. Because let's face it, if you ate a meal and an hour later you're hungry again and want to eat again, something wasn't right in that food choice. Lots of things could be wrong with it or right with it. But one of the easiest ways to make a change is our diabetes plate plan. So sometimes milk is out of the picture a little bit because as we get older, milk's a little harder to digest. So you can still get a lot of that calcium from your non-starchy veggies. So I'm not sure how well that picture's coming across the screen, so I'll just spare you that. But if you think starchy veggies are only a fourth of your plate, they're still allowed on the plate, but it's the portion that's in your hand, not maybe 2 hands worth, because this is now 4 to 6 servings instead of that 1 hand. Fruit, the little guy, why'd they pick that? They should have let it grow. This is a choice, a carb choice that could go on that same grain side of the plate. The non-starchy veggies, they're the ones that are lots of fiber. They'll fill you up kind of fast on very small amounts. And then meat or a protein. If you're more vegetable-based proteins, they still will count in both the carb side of the plate and your protein side of the plate, and they work. And that'll be great. And then it's that balance. So that mix of food, that's one of the things that we kind of sometimes lose is, once again, the more variety on your plate, the better your balanced response to that food meal is going to be. You got a meal that you're hungry in a couple of hours. Was it too many grains? Not enough protein? Too much time in between meals? The other thing too that helps line up what's on the plate and is it worth it for you is looking at the nutrition label, that nutrition facts label. And then the most important part is the ingredient list underneath. Anytime you're going, hey, I want to get this, maybe I want to get that, lay the 2 labels side by side and see what is it? What's it worth? The trick on a label is at the very, very top. There is this really important line called serving size. That's not the portion you necessarily are going to put on the plate, but that portion size that might say 1 cup, might say half a cup. Don't cheat yourself by grabbing, that way, this guy and calling it a cup. Yeah, no, this is the cup that measuring label for that food thing is talking about. And don't cheat yourself out of food and say, oh no, this little 1/4 cup guy is the cup. Because now you're going to be hungry again too. But measure it, because that's what they did for the label. And you want to look at the total carbohydrate line. Maybe if you have blood pressure or swelling problems, you might want to look at the sodium line and just see where does all that add up at the end of the day. Let's see, what else? Oh, well, when we eat, then we want to go take a walk. Put the dishes in the sink, let them soak, and then take a small walk or do arm lifts or anything that's strength training to help your body use the food that you just ate. Choose your drinks carefully because they could be the same size glass, but plain milk and chocolate milk, 2 different labels. Sometimes the chocolate milk's going to win, but then that means you have to give up some food off the plate because you're drinking your carbs and fats and proteins instead of chewing them. Meat, too, the portion size about the size of the palm of your hand. So that deck of cards, that palm of your hand, when you're out and about in the world, you got your hands with you all the time. Half a cup of your hands is usually a cupped hand. A guy's cupped hands is a little bit more. For women, our fist is about a cup, or our 2 hands outer is about a cup. So once again, if you've got a food label and it says a cup and you're kind of like, well, I don't have a cup with me, you can kind of estimate from your hands. The glasses for about 8 ounces is usually about your fist this way. And then like if you're trying to guess a tablespoon, it's about 2 tablespoons is about a golf ball or a ping pong ball. A regular tablespoon is like the length of your thumb. So those are kind of just some quick things. Like salad dressing is only supposed to be about 2 tablespoons. And when you're doing tablespoons, don't use the one in the bowl in the cupboard that you use. You want the actual measuring one, you know, the one you'd make your fussy recipes with, so that you don't, once again, cheat yourself with your food choices and how it counts up in your day. We talked about activity because that's another key piece to chronic disease management. Go slow. If you haven't done a lot of walking since last fall, start slow. Do it 2 or 3 times a day. The goal is to get up to 30 minutes above and beyond your regular work or regular activities to help manage blood sugar and blood pressure and stress. So start small and add it up each month, each day as you can go. You know, you listen to your body too, because if you haven't done it in a while and you knock yourself out and sprain your ankle, we kind of are not going to work out very far for very long, are we? Nice weather is coming, so enjoy the nice weather, but stay safe. If you go on the trails, check in with somebody, go with a buddy. You know, we're still in that stage of when we're out and about. My mask has disappeared, of course. Mask up. Good mask. You know, a couple of layers when you're going to be out or in a building. When you're out in nature and far away from other people, enjoy the fresh air. You know, enjoy nature. All the flowers are starting to come up. Relaxation things are very important to our overall health. And sometimes that works better for your diabetes and blood pressure management than worrying about, did I have the right portion on my plate today? Also, 3/4 of the time, we're hoping for as close to possible. 1/4 of the time, let life happen and own it. Own it. Some other things to help prevent type 2 diabetes, you know, if you're in that pre-diabetes category of your blood sugar fasting is 101 to 125, is stop smoking. You know, make 1 or 2 small changes to help with getting that activity or making better food choices on the plate. And following up with your doctor to stay on top of it. Because even if we had a spout where sometimes diabetes will flare and everything's really high, you learn the new meal plan, you get a new activity plan, we can back your medicine off. It doesn't mean that diabetes is totally off the radar, because the minute you don't stay vigilant and keep up on what worked to get you to your goal for your health, it can show up again later. So I'm wondering if anybody's got any questions out there. I covered a lot of stuff really fast. I can talk about anything you want. Pretty much diabetes wise, please.
Yeah. I have a question.
Yeah.
How does stress affect diabetes and blood sugar readings?
Stress can make your blood sugars go up because it adds a level of resistance. I'm glad you brought that up because I brought a little toy that explained insulin resistance. You know, when we're stressed, our body is in that fight or flight response. So it says, got to put sugar out to catch you to be able to be strong enough to deal with the stressor you're in. Chronic stress, unfortunately, just kind of wears out the whole system. So sometimes those really stressful events, your numbers will go higher, longer. And you'll be like, well, I'm barely eating, because some people, when they're stressed, don't eat as much. Some people, when they're stressed, eat a lot more. But it's one of those things that constantly gnaw at you. Kind of like dental health, if you've got like some gum disease, that constant stress may raise your blood sugar numbers high enough that we're going to be trying to change your meds when all we need is to fix the problem that's underlying. When we have bad weather, you know, it's supposed to get cold again this weekend, doggone it. When we're more sedentary, the cells are more tight. You know, the insulin knocks on that door, the cell can't open. You know, you got to have enough insulin to open the cell so that so that cell can make us go for that walk down to the mailbox or around the block or get the sticks picked up out of the yard. You know, you got to have the right amount of insulin to open that cell so the energy for that cell can function. So that's where meal timing and routine come into play, because then your body knows, hey, you're going to put gas in the gas tank. We'll use that gas in the gas tank, and it takes one more stressor off of the system. But happy stress will make your numbers climb too. Sick stress, when you're sick, you're not moving around as much. That'll make things a little bit higher as well. But it's key. It's one of those things that kind of wear you down in the background for quite a while.
What about so your numbers are high because you don't know you're stressed out. So what happens then? Your doctor wants to change your medicine and it's not working. Should people look at stress as a major factor of their sugar numbers rising?
It's a portion of the sugar number raising, and it needs to be identified and followed through, because is it the stress of the high blood sugar that's making more stress on your system? And the hardest part, I think, that it's very hard to look at what else is going on in my day that might be interfering. Is it missing meals that might make your numbers higher? Or is it truly the fact that no matter how balanced things are, your numbers are high, and that's the stressor? Because the higher your numbers, the harder your body is trying to work to just circulate the blood, insulin and oxygen, and everything gets off kilter. So it is a big piece, because I see both ways. It's like people don't recognize that they're stress eating. They just see numbers high all the time and they're frustrated, which makes more stress because they're trying the best that they can. Sometimes, holidays are coming. Alcohol, that first night or two, might make your numbers look higher. A day or two later, you might get a low blood sugar out of the blue and have no idea why, because we forgot that we had something at a family gathering or a special event or a special dinner. But yes, stress is one of those things that can be an underlying or a companion cause to that frustration of getting safe numbers. It needs addressing, and that's one of the reasons that you come to see the diabetes care and education specialist, because we'll sit down and talk about that. If knowing what to eat and put on your plate is making the meal hard to eat, or more stress than eating the food, or you start to get frustrated with it, see the dietitian or come see me, and we'll talk about it, and we'll see what works in your day. What do we have to change? What's already working good? I know a lot of people, when they first come in or they first get told diabetes or pre-diabetes, they think they've never done anything right ever. You've done lots of things right. It's just, where do we need to tweak it to make it work better?
So since you're on the subject of coming to see you, you're a diabetes educator for the hospital?
Yeah.
And what would a first appointment be like?
Oh, a first appointment is very much finding out, what do you need? Where are you in the disease process? If you're totally brand new, it's finding out where you are right now, because when you are new, there's just so much to learn. But you're going to walk away from our meeting with what you need for today. Sometimes at the very beginning, it's the meal planning and the activity, and maybe learning how to use your blood sugar machine. And then the more important part is, you might know how to poke that finger and write it down in the log sheet. How do you use those numbers? And that's like the follow-up visit. How do we use those numbers so that we can use those to help adjust care, adjust medicine, adjust food and activity? It's not school. I know a lot of people go, I hated school. I'm not going to go to anything that's an education thing.
No homework.
Yeah. And my homework, honest, if the dog ate the homework, I'm not yelling at you and sending you home to go get it. I mean, once in a while somebody's offered, it's in the car, and I'm like, do you remember at least the last couple of days? I do a lot of food recall because I want to know, how does this work? Because I feel my role is to make the diabetes care marriage in or match into how your daily life works. This isn't a one size fits all. It's, how does this work? Because if you're a shift worker, if you swing 8 hours and you shift all shifts in 1 month, 1 week is each a different shift, we have to work out a plan that's going to work for you, so that the whole idea is make this work for you. It's finding what you need. Sometimes you've had diabetes for a long time, there's some new technology things that maybe will make it more engaging again. It's not the same old, same old. There's some neat things for helping track injections. So if you're kind of like, oh, did I take my shot before I ate for breakfast today, or did I take it after I ate? Because lunch didn't come out the way I thought it would. We've got some tools to help make that easier too. Some of the working with your healthcare team, when you go to see your doc, maybe for the week or two before your appointment, pay more attention, track more of what's going on, so that when you're looking at a rough section, you can say, hey, this was rough and this was why. Or, hey, maybe you had 2 or 3 weeks that were really great. How can we repeat those great weeks more often? And that helps, because if you have a couple of rough weeks, but you had 3 rough, wonderful months before the last 3 rough weeks, you don't want us changing medicine on a couple of rough weeks. So please, yeah, this was my rough week. Help me out with it. Not, hey, I'm doing fine. I have no idea why I'm here. And let's talk about baseball. Whatever's coming up. Isn't that baseball's next?
We have another question from Joanna. She wants to know, does the risk of diabetes increase as you reach your 80s and 90s when your interest in eating changes?
That's a very good question. And age, unfortunately, does play a big role in it. And the older we get, you got to figure out that the poor, lovely little pancreas that when we were younger had all these wonderful cells to make insulin, as we get older, they start to disappear. So if you make it all the way till your 80s and your 90s, and you're right, your taste buds change, your food changes, your chewing changes as your mouth and things get older, teeth changes, you're more at risk. And the 65 and over group and older, yet 1/4 of them have a risk of having diabetes, where about 1/3 or 1 in 10 is in that 18 to 64 age group. Sometimes it is food choice. I mean, sometimes, take a good look at, are you grazing all day so that you're always hungry because you never get enough of the pieces of a meal to feel full. The other thing is rating your hunger. How hungry are you? If you wait till you're a ravenous wolf, it's very hard to be happy with vegetables and a meat and a little bit of a starch, because you're going to want to eat whatever's on the counter while you're cooking what you were hoping to have for dinner. Swallowing changes, nutrition needs change. If you've had diabetes or high blood sugar or any stomach issue, GI history issue things, sometimes your stomach doesn't absorb the nutrients as good. So that can be another factor that will change what's going on. Yeah, that the aging, illness, dental work will change huge.
So what about food logging? How specific do you have to be when you log your food?
Well, if you're going to do a food diary, it is a wonderful tool, but be honest about everything that goes in the mouth, whether it's a cup of coffee and what went in that cup of coffee. If it's a sandwich, or was it 2 sandwiches? Sometimes people get a flat wrap bread sandwich thinking, oh, that's less carbs because it's flat. It might be the same carbs or more than if you just did a couple slices of bread. But if you're going to do a food log to see what works and where some challenges might be, literally use the measuring cups. Don't, so you really truly know what was going on. If you got a food label, really look at that food label too and see what else is, but be honest with it. And sometimes right down to the water, sometimes too, maybe rating your hunger, rating your stress. Did you sleep? If you have a sleepless night, your numbers are going to be rougher the next whole day, all day. If you have sleep apnea, and you haven't had your machine adjusted in a long time, or you've never been tested, that might be a risk factor for that prediabetes, diabetes, high blood pressure. It increases the stroke risk and heart attack risk as well. So it's, when you do a diary, write it out and then turn around and use it. If you're tracking everything, at the end of the day, the end of the week, go back and look at it, or bring it on in and we'll look at it together with you and see if something stands out. But yeah, if you do it, it's a wonderful thing. But I've had people track and they said, well, I can't go take my walk because I have to write down what I ate. No, sorry. Go for the walk. The walk is more important than tracking. But, and let's face it, when you go to online or go to the bookstore, there's books that will give you thousands of foods. Think about it. We only eat about maybe 50 foods all the time. If you think about every food you've eaten in the last month, a lot of it's the same food. So once you learn your favorites, it's easy. It's hard the first day you look at it and you're like, whoa, what am I doing here? But pick breakfast and say, I'm going to work on breakfast foods I normally eat. And then if they work for you, work on lunch. Or sometimes people want to do it by certain food groups. But that's, once again, how did that food work for me? And even if you don't check your blood sugar, you can do it by how much energy did I have? How fast did I want to go take a nap? How soon was I looking for food after I just got done with a meal? Because remember, if something's high in salt, you might need a glass of water, but your body's going to say, I'm hungry first. But it really wants a glass of water to get rid of the extra salt. Even if you weren't salting at the table, the food might have had salt added more than maybe what you need or want. Does that kind of make sense?
Yep. Thank you.
What are some signs and symptoms that you might have diabetes? Maybe you're not sure if you have it and you want to get checked out, but is there anything people should be on the lookout for because they're not sure?
Yeah, that's a good question, because sometimes it's probably almost harder to swallow diabetes, the diagnosis, when I did my routine blood work and now they're telling me I have diabetes. Because the best place to catch diabetes or find out that you have it, you didn't catch it, your body is just not managing what it's supposed to do on its own. It's asking for help. The best time, though, is before symptoms start. That's why it's so important to have your workplace wellness physical. Get that blood work to see, what is my blood sugar when I'm not eating? When you're fasting, is your blood sugar safe? If it's not, it's a clue that we need to make adjustments. Some people will notice being more hungry. Some people notice being so thirsty that no amount of water, in fact, water for some people doesn't satisfy the thirst, so they start drinking milk or they're drinking pop. And that just starts this whole terrible snowball of thinking of the avalanche. Every time we drink something more, the blood sugar goes up. The body says, but I don't want this thick syrup in here. I want to thin it down to water again. Makes you thirsty. We drink more of that, whatever it was that just kind of semi-satisfied it. So that very, very thirsty. Of course, when you're thirsty and you're drinking more, you're going to the bathroom more. So, and then that's one of those signs that gets missed, especially in the summer, or if you work in a job where it's very hot, you're like, I'm drinking a lot, so of course I'm peeing a lot. But it could be a sign of diabetes. Find out sudden weight loss. So once again, weight loss from the fact that your body is not able to use any of the food that you're given it, because there's not enough insulin to get it in the cells. So you might lose weight, and a lot of times we're looking to lose 5 or 10 pounds, or maybe 20. So we'd step on the scale and go, yay, I lost weight. It might be because your body's eating you to feed you. And that's not safe for the long haul. That's how you get that nausea and more tired. And sometimes you get to that vomiting or not waking up or very tired. Wounds that won't heal is a very late sign of diabetes as well, because that high blood sugar interferes with your white blood cells fighting off infections. So once again, that's why a lot of cold season, flu season, COVID, people with uncontrolled blood sugars were at higher risk for getting sicker faster or being sicker longer, because that blood sugar being too high got in the way of their immune system fighting it. Or you might find a lot of things too, is like you might go, I had a bladder infection. Oh, thank you, it's gone. Doggone it, what do you mean it's back again? An infection that just keeps coming back can be when the blood sugar is higher too.
Okay, we have another question from Bernadette. Does lack of sleep affect your sugar?
Yeah, it puts a layer of resistance up there. And that's, being tired is almost worse than being drunk. When there's some studies done of how exhausted are we. Sometimes people that can't sleep through the night, what's keeping you awake? Take a little inventory and see what's going on. But it adds a layer of insulin resistance, just like smoking adds another layer of resistance that can make us more prone to developing type 2 diabetes or make pre-diabetes more difficult to break through. But yeah, sleep is huge. It's a stressor. And then, think about it, those nights that you didn't sleep good, making a good food choice the next day is very difficult. And even planning food, because then you take a nap instead of taking the walk. And then you're kind of behind that 8 ball the rest of the day. Makes more of that resistance where nothing's going to get in there until we get that sleep. And, granted, everybody needs different sleep. Generally, we're saying like maybe 6 or 7 hours, usually around 7 hours. Some people need 10, but if you're doing 12 or 14 hours a day, including your naps, that's also a sleep problem. Even if you are excessively sleepy, that's another sign that there's a problem. To, find out what's going on, what's dragging that down for you.
So would insurance cover a visit with you, and do you need a doctor's referral to come and see you?
Yes, for insurance, most all insurances will pay for diabetes. Some pay for pre, some do not. It does take a doctor's order, and because I'm an outpatient department of Ashtabula County Medical Center, any doctor can fill out the order. If you're not comfortable asking your doctor for an order, tell me. I will send them a note that says you'd like to sit down and talk, and we can, look at your plan, see what's working great for you, see where we can help you out. Some insurances will cover for 2 or 3 visits. Medicare pays for like 10 hours the first year, and they want 9 hours in group, but because of COVID, everything can be one-on-one right now. I do virtual. I'm game to try that. We can share whatever platform you're comfortable using on the phone. Sometimes works too. If you kind of like learning a tool, maybe if we have the video capacity. If you don't, we mask up, gown up in the office. It's not gowning, but we mask and wear a shield, and you wear a mask. And of course, we all go through the COVID checklist coming into the building, any building, anywhere. And we're just going to be safe. Whether you've had your vaccines or not, it's still wear the mask to be safe. Oh, great. I want to take a second here and click a button that maybe will tell me if I'm missing something. Oh, the mouse went to sleep. Why won't? Oh, there we go. I found the right button.
I don't see any questions.
Okay. I didn't see any questions for participants or chat people over here in our team meeting. And it was really great to talk to you out there in live Facebook land too. In the team meeting here. And
you want to leave your name and your phone number in case I want to get a hold of you, your contact info?
Sure. You can call the hospital number, but my department number is it's the 440-994-7598 is scheduling for the diabetes education, care and education program. Some neat services we have, besides working with your family practice or your general practitioner or your nurse practitioner, we also have an endocrinologist now at Ashtabula County Medical Center that can see anybody if you wanted to make appointments with them as well. So we all do a team effort here between working with your doc, working with you, and working with the endo and our dietitian as well. Okay?
All right.
Great. So thank you everyone
Thank
for
you.
participating. We will be having another Lunch and Learn, and that's going to be with Dr. Dunbar, and that's going to be Wednesday, April 14th at noon. So we will be sending out a reminder about that as well, but don't miss that one. And thank you, Lori, so much for taking the time to do our Lunch and Learn today. Thank you.
Thank you so much for inviting me.
Thank you.
Thanks.
Thanks everyone.